To many parents, diagnosing a child with depression as young as 2 years old sounds unconscionable.
I mean, it's astonishing.
Many asking, what toddler doesn't cry or become irritable? What toddler doesn't become bored or unhappy at times?
Especially the 2-year-olds, something doesn't go her way and she just falls apart, literally onto the floor, screaming.
But in fact, the diagnosis is becoming more and more common. It even has a name now, preschool depression, and it's estimated 84,000 of America's 6 million school children, these are kids ages 2 to 5, are clinically depressed.
For preschoolers, really the hallmark of depression across the age range is really a lack of pleasure. And these kids are just not happy. They don't enjoy life the way ordinary kids do.
Dr. Stuart Goldman, the director of the Mood Disorder Clinic at Children's Hospital Boston, says it's the type of sadness that goes beyond having a bad day. In many cases, these children can't remember the last time they had fun. They experience prolonged periods of sadness and irritability. They often act younger than their age. While there's no doubt kids as young as 2 years old can have significant behavioral and emotional issues, some healthcare professionals are concerned with the actual label preschool depression. Dr. Lisa Cosgrove, a research lab fellow in the Edmund J. Saffer Center for Ethics at Harvard University, warns by collapsing children's issues under one name and labeling it as a disease, we may inadvertently be deflecting our attention away from the other issues the child may be suffering from.
Well, I think they could be the result of a number of factors, such as abuse, trauma, attachment difficulties, poverty. A number of situations and stressors and traumas can certainly cause those kinds of behavioral and emotional difficulties.
And then there's the issue of medication.
It seems to be what all our society is about now is medication.
Cosgrove's research looks at the influence of pharmaceutical companies over the medical community. The FDA doesn't approve a drug unless there is an identifiable condition for it to treat. And Cosgrove wonders if there was a rush to put a label on preschool depression to help grow profits.
I think there are many well-intentioned and very good researchers addressing the issue of preschool depression, but I think we need to be careful that no one is playing handmaiden to the drug company's desire to make profits by expanding the market of what would be treatable.
One of Cosgrove's concerns is the younger your patient, the larger Big Pharma's customer base becomes.
And so the concern would be, what would the early intervention look like? Would it amount to predominantly medication?
For now, there is no standard course of treatment for preschool depression. Much of it depends on the severity of the case and family history of mental illness. Meds, according to Dr. Goldman, are used by most doctors as a late resort.
I think most child psychiatrists are not excited about prescribing powerful medications to 3 to 5-year-olds. On the other hand, they don't want kids to be suicidal or end up in the hospital either.
And for those who doubt the diagnosis, Dr. Goldman says proof is in this picture by a little girl who tried to commit suicide at just 3 years old.
And she said there's a little girl behind the rock, and nobody knows where she is, and her mommy doesn't know, and she's hungry, and she's cold, and even Santa Claus, and that's why it's right around Christmas, is not going to be able to find her.
Sarah Underwood, Fox 25 News.